My provider diagnosed me with IBS, but didn't tell me why I have IBS. And again, it is something that is off in one of those three main parts. So with SIBO, that small intestinal bacterial or microbial overgrowth, because it could be outside of bacteria, fungi, something called archaea, we do know that that accounts for 14 to 70% of irritable bowel syndrome. So if you've been diagnosed with IBS, you really want to look into SIBO, IMO, SIFO, and really just try to understand, do I have this? Because we do know, again, that that can lead to those IBS symptoms. And there are many common causes of it: excessive antibiotic use, like I mentioned, food poisoning or post-infectious gastroenteritis, prolonged low fiber, low antioxidant diet where those gut bugs are just starved, the healthy ones. We know hormonal imbalances, whether that's thyroid hormone, sex hormones, any other hormonal imbalance, chronic constipation. And that could be from any of those other things that I mentioned. Like I mentioned, pelvic floor dysfunction, dysfunction of the little valves or little doors that separate and compartmentalize the gastrointestinal tract. So many more. There could be many, many causes. And I even say SIBO is not a root cause diagnosis. So when someone comes to me and they are diagnosed with SIBO or we're identifying they have SIBO, we're still asking, why did you have this? Why do you have this? How did you get here? What's going on
It's even deeper.
in the structure, the function, the population? So we can say not all IBS is SIBO, but all SIBO is IBS. So again, if you've been told you have SIBO, you do have IBS. You do have irritable bowel syndrome, but we want to ask, why are you irritable bowel? What happened to you? What's going on? And with this condition, with specifically small intestinal microbial overgrowth, I tend to hear common things, and there are documented common symptoms. Very commonly, people will find I wake up with a flat stomach, and once I start eating or drinking anything, once anything is interacting with my gut bugs, I start having progressive bloating to the point where by the end of the day, they might look and or feel 6 to 8 months pregnant. So the distension, which is the appearance, the bloat, which is the sensation, is excessive to the point where I have patients. I just had a patient yesterday. She said, I haven't left my house in 2 weeks. I'm having such a bad SIBO flare, and it was a perfect storm for her. I have patients who say, I can't wear pants. I haven't worn pants in 5 years. So they'll just wear dresses and flowy things because even a waistband of leggings is painful for them. So if you're having that cumulative excessive bloat that's causing that hypersensitivity of nerves, you might want to ask your care team to check in on this for you. They might find because of inflammation and opportunistic inflammatory bugs, they're having mucus or blood in their stool. That's always something you want to bring up to your care team because that should not be happening. That indicates there's a breakdown or excessive inflammation. They might have, again, malodorous gas. So ask yourself, does my gas have a strong smell? Really, if your gut is healthy and everything's in balance and harmony and good flow, your gas should not smell. So it should really smell like nothing. You should not smell the food that you've been eating. That means you're having malabsorption. It shouldn't smell like a petting zoo, an outhouse, or a cow. That indicates methane is present. It shouldn't smell like rotten eggs. So the smell can actually tell you about who's living in your gut, but you shouldn't have malodorous gas. You shouldn't have gas that's in excess of 15 to 20 times a day. And you shouldn't have trapped gas that you can just feel piling up and isn't passing. Really, you should have a healthy daily detox in your bowel movements, in the form of your bowel movements. It shouldn't come out with a strain and constipation. You shouldn't be skipping days, and it shouldn't be just spilling out of you to the point where you're seeing, oh, wow, I just ate that 8 hours ago and it's undigested in my stool. We should also not really be seeing that you're having spontaneous or uncomfortable belching that either is malodorous or feels like it was stuck or feels like you have to belch in order to alleviate some gas. Those can clue you into some of the signs and symptoms that your body's saying, hey, something is off.